Our clinic is very subspecialized. We are experts in all areas of spine care, both conservative and interventional, and we also specialize in chronic nerve pain or neuropathic pain. One of the most common of these is called complex regional pain syndrome. It usually occurs after some type of injury to an extremity and the patient suffers from a chronic nerve pain. It can be very severe and life-altering. DRG, or dorsal root ganglion stimulation, is a brand new type of therapy that is very effective for certain types of neuropathic or nerve pain. It's the use of a very small electrode that gets passed through a needle into the epidural space of the spine, and then it applies an electrical signal to a very focal part of different spinal nerve roots. The results for complex regional pain syndrome have been truly remarkable and very exciting.
I injured my knee when I was 7 in gymnastics, and during that time I had no life. Nothing really helped. I just had constant pain every day. So I went and saw Dr. Heroes, and he instantly, as soon as he saw me, knew I was a perfect candidate. He was very confident that he could help me and what they could do. And I had the trial done, and I woke up and I had no pain. I was in tears. I had no pain. I've never had that. 19 years of just constant, every day. So it was a really beautiful thing.
I had a torn meniscus, and they went in and did a meniscectomy. And it was always painful, and it always burned. And I can't tell you how many years I spent sleeping with my knee hanging off the edge of a bed, just because the touch of the sheet would cause some pretty extreme pain. And so I went in, and he didn't really have too much of a problem diagnosing me with CRPS. When I had the operation about 6 weeks ago, on day 10, I went out and I walked 3 miles. I walked 3 miles and I had no pain. My knee wasn't holding me back.
I started playing roller derby quite a few years ago, and within the first 6 months, I ended up getting an injury to my knee. All of the different doctors that I went to see had no idea what was going on. And even if I would move like the skin on top of my kneecap in certain ways, I would just be like the sharp electrifying pain. It was just frustrating thinking that this is what the rest of my life is going to be like, and not knowing how to cope with that. That when he told me this is what I have, and we might have something that could work, I was just sobbing. I can't say enough positive things about Dr. Heroes and all of the staff. I mean, I've never met a better doctor. He really does live up to his name, Dr. Heroes.